Have you ever had persistent Achilles pain that you just couldn't get over? Most runners are going to deal with some sort of Achilles tendon pain at some point in their career. I've come across a lot of runners who have been frustrated by the rehab process. It's usually because there's no sensible progression. They don't have confidence going from hurt to full training. They have trouble bridging that gap. Oftentimes there's no measurable objective way to progress training. So how do you go about that with Achilles tendonitis? Traditionally, 3 sets of 15 has been used. It's a famous protocol and it's been used and many people have had success with it. However, 3 sets of 15 eccentric heel raises is going to look different based on the individual. In other words, you can't just give somebody 3 sets of 15 eccentric heel raises and that's their rehab. You got to progress it. So how do you do that? So pain symptoms has been used in the past to progress rehab for Achilles tendonitis with success. So in the original protocol, when athletes perform 3 sets of 15 eccentric heel raises, the load, the weight that they carried progressed or increased when they no longer had symptoms. In other words, they were encouraged to perform their exercise with lower level pain symptoms. Pain was sought out. This has been demonstrated multiple times in a few different sports. Performing rehab exercises, return to run, return to sport with low-level pain symptoms is typical and doesn't mean that you're on the wrong track. If anything, it might be a good thing. With distance running, the Achilles tendon is going to take many times one's body weight. It needs to carry or needs to tolerate heavy loads. Adding weight and recognizing that low-level pain symptoms isn't necessarily a bad thing, maybe a good thing. This might create sufficient load and create or promote a better adaptive change to the tendon in order to heal and be more prepared for your sport. This is to stress that this is for Achilles tendonitis. This is for tendons, how they respond to pain. Reframe those pain symptoms. They're okay. If you're still having trouble with Achilles tendonitis, it's recommended to treat the tendon for at least 3 months, before considering alternate treatments. And it's been shown 6 weeks to a full year. This is the amount of time that a tendon may take to adapt. It takes time. Reframe those pain symptoms. You don't have to be fearful. Rather, use them as a tool to progressively progress your rehab and be better prepared to meet the demands of your sport when you are back to full training.